Good morning, guys. Here we are for our 7 month update. Again, these videos are for people who are doing research for their own healthcare journey. If you're watching this because you have been involved in my treatment plan this whole time and love and care for me, I will be brief and say that I am doing phenomenally well. I honestly feel like I've been saying I feel like I'm rediscovering myself, but since this has been going on since I was 17 and I'm 35 now, I almost feel like I'm discovering myself for the first time. And in some ways, I feel like I'm a whole new person. It was like this cloud or shadow was just always over me because it was like through this lens of trying to manage pain or be okay through the pain. So that's kind of where I'm at now. And thank you for your support and for your love and for staying up to date on my journey. So let's get into the nitty gritty now. So, pain wise, I would say that I am at baseline, I have no pain at all. So, as a refresher, I had pain in my right joint from the degeneration that was there as a result of a osteochondroma or a bone tumor that was shifting the midline of my lower jaw to the right, and the pressure had caused originally just arthritis in the bilateral joints, but it led to degeneration and the time it took to diagnose it and to eventually get to surgery. So that pain before surgery was probably ranging anywhere from 3 to a 5 for years. And then by about 3 or 4 years before surgery, it started climbing up closer to 5 or 6. And it kind of managed somewhere in those ranges until the month before surgery. It got excruciatingly bad, and I would rate it around like 7, 8, or 9. So now the fact that I have no pain in that spot is absolutely astounding to me. I am relearning all of these life patterns that no longer hurt me, such as driving in a bumpy car, riding my horses, exercising, eating. Oh, this is Cypress. You wanted to say hi. I know you just had to be involved, huh? Um, so when I do have pain now at 7 months post-op, it is in my Lefort and primarily on my right side because that was the side that had to get advanced further. Um, it feels like pressure primarily, especially right before a thunderstorm. I feel it in both sides. Every now and then, which I'll get into swelling in a minute, if my swelling flares up a little bit, then I'll feel, or if I'm pushing my jaw from like a physical therapy or chewing perspective, I feel it in my masseter here. And then I've found if I'm a little bit stressed or tense or I've had a long shift at work, there's tension up here in this temporalis muscle that kind of runs through here. Uh, None of this even compares to what I felt preoperatively and almost doesn't even feel like it's worth mentioning. So, um, when I do have pain, I'm taking ibuprofen, and I did take a couple of preventative tizanidines, PRN or as needed, when I had some pretty decent flooding with some recent weather out in the horse barn, and I did 18 hours of labor in 2 days. But overall, I'm not taking any pain medicine at all. And then I'm pre-medicating for orthodontist appointments, dentist appointments, anything where I know we're going to aggravate or flare things up. Um, Scars and swelling wise, I only wake up with swelling if I sleep on my side, which I'm trying very, very hard to be intentional about sleeping on my back, which is not my favorite way to sleep. Dr. Movahed said this could take up to a year or more for me to comfortably sleep on my side, which is okay. Just something to consider. But when I do sleep on my side, I definitely have more swelling, kind of generalized and everywhere. Uh, Scars are doing very, very well. You can't even see the ones on my ears, and then the ones down on my neck are relatively invisible as well. We'll show you the other side. And then my belly incision is also healing nicely. That was where he took fat grafts to put into the joints. That's also healing well. As it's starting to get warmer out, I am being conscious to wear sunscreen every day, which was probably a good pattern for me to get into, anyways. But that helps with scar healing. Sleeping, I kind of alluded to already. I'm really trying to be intentional about sleeping on my back. Um, if I have any area that flares up my pain, it is clenching at night. That's been kind of the battle that we're fighting. So, CBD helps with that, as does the PRN or as needed tizanidine, which is a muscle relaxer on the days that are rough. And then sometimes if I'm feeling tight, I'll just take some ibuprofen before bed because once I start clenching at night, it starts to spiral where things just start to get worse. So that's probably the biggest battle is making sure I don't do that. Um, Rehab schedule, you guys, this is the first week since 6 weeks post-op that I haven't had an appointment for my jaw. And I've just been so grateful for all of my treatment plan um, uh, providers and also for the rehab schedule. But gosh, it's been a lot to maintain. I just counted. I had 61 jaw related appointments in 22 weeks. So it was a lot. We've now spaced physical therapy to once a month, and that's mostly just to track and make sure that I'm not losing progress because I hit my goal this past week of my opening being 40 millimeters. So um, when I started at 6 weeks post-op, my opening was 18 millimeters. So we've made significant progress in that regard. And I definitely can tell when I'm trying to eat and just my daily function that my opening is getting bigger. They said they don't want me getting much larger than that just because of the joints. You don't want hypermobility. So 40 is about the goal, but it's still uncomfortable for me to stretch to 40. So I would hope that with time I can continue to get to that range of motion without it being uncomfortable. When I had my follow-up appointment with Dr. Movahed last week for the 6-month follow-up, we noticed in the scanning that my tongue is not positioned in the right spot in my mouth, and that is 100% myofunctional therapy. I was doing that every 2 or 3 weeks, about every 2 weeks for a while, but I fizzled out of it just because of the cost and insurance not covering it, and primarily just how overwhelmed I was with the rehab schedule. But now that we've spaced physical therapy, I'm going to get back. I called them this morning to get scheduled for that. And I'm hopeful we can do it every, I don't know, every 3 weeks or so, just to continue to work on my tongue strength and the movement of the muscles in my face and in my mouth. Um, I'm also doing chiropractor and med spa. I was doing it every week. We spaced it every other week. And now I'm trying to go 3 weeks with that. So we'll see how that goes. My neck has been significantly better since my surgery, which has just been so encouraging and happy because that was causing a lot of discomfort as well. Diet wise, oh my gosh, every day is an adventure eating food. I love it. This past week, I introduced chocolate covered almonds, which is one of my very favorite things in the world. I did cut them in half and I put one on each side of my mouth at the same time so I could bite evenly. I didn't get coaching on this. This is just what I chose to do. Uh, it made me sore, especially across my Lefort. Um, but I did it and it was amazing. So that's probably the newest food. I haven't done anything that's chewy like beef jerky, Laffy Taffy, dried fruit. I am not in a hurry to get to those places just because like I didn't chew for over 2 years. And so just getting to eat all of these foods has just been absolutely delightful. So as far as my treatment plan goes from here, I have an orthodontist appointment in 2 weeks to get an update on where we're at on a timeline. Originally, he told me it would be about 6 to 9 months after surgery to complete the orthodontic work, although he wrote a letter for Dr. Movahed that I provided at my follow-up appointment last week. And in that letter, he mentioned I would be in bands for 8 more months. So we have not had that discussion yet, but I need to remind myself that this is a long term game and that I need to be patient. I'm just very ready for the braces to be off for a lot of different reasons, but the work that we're still doing. So, because I had a Lefort, which is where they take the top part of your jaw and separate it from your skull. And then I had a 3 piece Lefort, which means he cut it into 3 separate pieces. They had to make a gap right here in between those teeth so that he didn't cut the nerves or the roots in my teeth. And so we are closing those gaps with a power chain right now. And then additionally, we're just correcting some of my bite. It doesn't quite line up, especially on my molars. And then the last thing is I have a bit of I think it's an overbite where my underjaw is back a little bit too far. Um, Everything bone wise is in the right spot. The joint is in the right place, but my soft tissue in my face is still pulling my jaw back because that's where it lived for 17 years. So as a result, I have rubber bands that go from it's the fourth tooth here back to the second molar, and that's pulling the jaw forward. So I'll kind of pull my lip back so you can see those. I take them out when I eat, but only because they pop out when I'm eating or they get caught in the food. But I've been swallowing a lot of them. So now I just take them out and put them back in afterwards. But here's the bands right there. And that's what he said I needed 8 more months of. So we'll see. I have that appointment on, I think it's May 6th. So I'll have an update for you guys at the 8 month post-op video. That's where we're at with treatment plan. So really it's just rehab and orthodontics from here. Um, Lastly, insurance. I was hoping that my journey would be done by now because I had gone through the appeal process with my insurance with 4 different steps involved in that. I still feel that they owe us about $5,000. And so that was what my most recent appeal was for. They denied it with no explanation. And so they told me that my next step would be to ask for an external review in a formal letter I had to mail them. So I did that. And then they called me and left a voicemail saying my case doesn't qualify for external review. And my next steps is to file a complaint with the Indiana Department of Labor. Um, so I think I'm going to go ahead and just start making my insurance video for you guys now. My plan is to make a PowerPoint if I can figure out how to do a voiceover of me talking through it, just because there's so many visuals that are important. And this topic is so confusing and not clear. So I'm going to start working on that now that I don't have as many appointments. I have some more time at home to do things like that, but I'm very passionate about educating everybody on the insurance journey, especially if your surgeon is out of network, which was the situation that I was in. So I'll get to work on that. I'm also working on filing a complaint. The reason it's with the Indiana Department of Labor is because my insurance is a privately owned insurance. Although yesterday I played phone tag for, not phone tag, I got passed around quite a bit through the Indiana Department of Labor, and no one could tell me what the process was for filing a complaint. So I called the Indiana Department of Insurance, and they said they actually manage it, even though it's a privately owned insurance. So we'll get the ball rolling on that. I have about 200 pages of supporting documents to send them with an explanation. So I'm not sure what the turnaround time will be on that, but I'll keep you posted on that as well. But please message me with any questions, comment on my YouTube videos, follow my Facebook page From Fear to Freedom, my journey before, during, and after TMJ replacement. I'm here for you guys. You are not alone, and there is healing out there for us. We just have to be educated. We have to be prepared. We have to be proactive, and we have to own our own outcomes because this journey is not easy and it requires a lot of strength and dedication. But we're up for the challenge because we've been through so much already.